As part of the Technology Snapshot series of the Global Clinical Engineering Alliance education system, I have the privilege of introducing Dr. Yanai Krutman, who will address the area of his research and publication on the technology-based system known as the Gama Knife radiosurgery, a type of radiation therapy that can be used to treat tumor veins that have developed differently than usual in the brain. Like other types of stereotactic radiosurgery, Gama Knife radiosurgery is not a standard surgery because there is no traditional opening or incision through the patient's skull. Instead, Gama Knife radiosurgery focuses many tiny beams of radiation on the tumor or other target with extreme accuracy. Each beam has very little effect on the brain tissue as it passes through, but the strong dose of radiation that delivered to the target where the beam concentrate is where the effect takes place. Dr. Yanai Krutman is a well-published medical physicist with training in engineering, physics, and medicine. Dr. Krutman is a former head of the Department of Medical Physics at the Institute of Oncology at the Soroka Medical Center in Beersheba, and is presently at the Ben-Gurion University of the Negev Nuclear Engineering Unit, and he is the head of the medical physics at Clalit, one of the oldest public general health organizations, as well as practicing as operation and quality assurance physicist at Kalal Biotechnology Industry in Petah Tikva. All of these appointments are in Israel. Because the sound may be of poor quality and difficult to hear on today's interconnection across the globe, I ask you to please increase the volume on your speakers because I'm sure that you wouldn't like to miss anything from today's Dr. Krutman's teaching. Dr. Yanai Krutman's topic today is Gama Knife operational issues and radiosurgery from the point of view of the user. Dr. Krutman, the floor is yours.
Thank you very much for the invitation. I'll start to talk about the Gama Knife stereotactic radiosurgery. Here you can see some of the very important publications that are during the years that were released, and you can consult them and to see how to provide to your institution a protocol and to use this departmental protocol as your guide for the technology to be installed, implemented, or when you have a software modification, when you have a practical understanding of the whole system, you can modify, as you can see, based on these protocols and papers. Next. Here you can see the system that is called Paradigm Phantom with actual gamma beams inserting onto the brain of the patient. And this is a very precise procedure and has to be calculated everything and implemented as the best as we can. Next. I will try to show a brief history of stereotactic radiosurgery, and we'll discuss the operational concepts, including mechanical, electrical, dosimetry, and information technology. And this should lead us to daily, monthly tests, annual tests that will be followed on as a major requirement to provide a very good assistance and maintenance for Gama Knife radiosurgery device. They have also the equipment that will be interested to know to use in this equipment in order to have the systems in a good sequence of tests. And for the end, we talk about the dosimetry of small fields because the size of the fields are very, very small. Next one. Here, a brief history of static radiosurgery. Started in the 50s in Sweden. Dr. Lars Lex applied protons in radiosurgery. But the cyclotron that produces the protons is not a device that you can find in any hospital. So this led him to develop in 1968, a solution that was the technology based on microspheres of cobalt-60. The microspheres of cobalt-60 it was implemented first in Sweden, after that in Argentina, and then it went to other places in the world. Nowadays, this system can be technically around 200 microspheres. The numbers went from 192 to 201. The very huge problem here, or the very complicated problem here, is the field size. The field size for a cyber knife is something like this, compared to other systems like the Brainlab MLC, and radiosurgery windows or fields from other manufacturers. Next slide. So in order to check the electrical, mechanical, you can put the phantom on a CT. The phantom is intra during the process, and it's now in a position that is not modified during the CT. Then you can send different points of this phantom through the CT to the TRS, or treatment system, treatment radiation system for your system, and check this afterwards in a form that you have the mechanical position assured by your phantom and the moving of this phantom through the field that you want to irradiate. In such a way, you can check everything that we should perform during a treatment. Next slide. For example, in the old days, you had the mechanical, included the pneumatic systems that at those times was very important. The phantom to check the central position of the region that you have to irradiate, it's always centralized in X, Y, Z coordinates of 100 centimeters. You have to include the tables with equipment specification. It means what is your small movement that you can perform, and what is the documents that are necessary to check this test and to record them. It will be a base for your maintenance during all time that you will use this phantom, this system, excuse. This can be compared here with a treatment of a phantom, let's say. The phantom is centralized in the machine. You have the ion chamber inserted, and you can check the performance according to your technical specifications that the system is giving to you. You can check. Next slide. Here you can see a check that is made with film inserted in this square. The film is for example, a radiochromatic film that there's no need for film production, because the radiochromatic film itself, it has the property to change the color at the place that you irradiate. And then from this you can have a profile of this beam, the small beam, in your coordinates according to the system coordinates that at the middle we have 100, 100, 100. This is the central point of your phantom check, and you can use it on the acceptance test of the equipment through the whole life and maintenance of the system itself. Next slide. In order to have an acceptance test to use as a base for your maintenance, you have to have consider from the manufacturing manual through the acceptance test during the installation of the system itself, when the engineers from the factory, in this case elector, are present on your place, and you can use them as your basis to develop daily checks, weekly checks, monthly checks, and the annual review that you have to perform periodically, and take record, and you have to take and to record these numbers of these features every time you perform the test itself. Next slide, please. In order to have order things, you have to know the software data and backup system, what you have to do. If you have a daily backup, weekly backup, etc., you have to check this list of data backup, and you have to assign staff to be responsible in this software data backup. I have, of course, to prepare tests for the software data itself, and once a year, once a half a year, in a periodically time, half a year, 1 year, 3 months, you have to perform those software data backup tests and to record, of course, the results. And then during the development of the maintenance, you will decide by yourself how many times you have to perform these tests. What is more important here is that everything should be documented, very well documented, and reviewed and checked by everyone from the staff that is responsible for this procedure. Next slide, please. During the treatment, for example, there are many protocols to prepare the treatment itself. The treatment should be very, very well known for all the participants of the stereotactic radiosurgery group, including the medical doctor, the nurses, the radiographers that are involved in this procedure, and the physicists that have to calculate the dose distribution, and the clinical engineer that is responsible for the maintenance and good functioning of the whole system. Here I have some examples on phantoms of how to take the number of points that are very important to proceed for the different types of treatment that you can perform here. Next slide, please. One test, the very good test, is for the beam accuracy. You have from 4 millimeters and both configurations for 8 millimeters, 16 millimeters, and so on. In every one of these systems, you have to check the profile and measure the beam accuracy and record these in your own record system. Next slide. Another thing that you have to prepare is a list of equipment that you have to use to perform this test. The list of equipment, which should include the mechanical, electrical, dosimetry, and software and hardware that are being used for this procedure. Everything has to be very well known for the team of the clinical engineers that are involved in the maintenance of this system. If you have, for example, performed some tests, you can include these on your own software. But in case to check the software itself, that you develop it in hand, for example, Excel, something else, you have to write your own protocols. And if you are able to have the three-dimensional source software. It should be accompanied by tests for acceptance and maintenance, and everything should be recorded and very well known for everything of the clinical engineering stuff. Next slide, please. At the end, we have some other assignments to remember. So one of them is a review and updating of the clinical protocol. In this case, the staff, the whole staff, the medical staff, the radiographers, nurses, social workers, everything, everybody should be constantly involved. At once a month at least must be a meeting of the staff, and everything that you are able to do and modify should be written and modified in the protocol. The symmetric procedures, of course, be periodically checked and recorded. And in this case, it can be prepared for some differences. If you know some differences and you have to perform a complete change of the symmetric procedures, you have to make all checks. For example, once a year, or in the case that you have a fault in the system and you have to change some mechanical, electrical, electronics, symmetric pieces of the system itself, you have to provide a full tests and to record them, of course. If you think of this time, about the time, what kind of tests you have to be procedure, so you can change in the protocol, and you can be able to provide a new technical protocol for the system itself. The whole staff should be able to modify according to your specific uses or applications. In your hospital, in your clinic, it should be, the staff should be able to perform a modification and, of course, write new document for the protocol to be used by the staff. Next slide, please. Thank you very much for participation in this short seminar. And if one of you or every one of you has a question, please send to my email that is written at the first slide. Thank you very much.